Logan Health primary care physician, Dr. Josephine Wright.
Hi.
Good morning. Looks like you predicted I was going to lose my voice, and I lost it.
Oh, shoot.
Tell us how you came to be here in the Flathead at Logan Health.
Oh, yes. So we came here about 2 years ago. We joined Logan Health. My husband is actually also a physician at Logan Health, and he's from here. He's a Columbia Falls native, so we wanted to come home and have been loving it so far.
Mm-hmm. Tell us a little bit about your background in medicine.
Yeah, so I went to medical school at the University of Washington through the WWAMI program. I also went there for undergrad, and then after that did my residency at the University of Utah.
Oh, Utah, huh?
Mm-hmm.
Now that's a burn center down there, isn't it?
Oh yeah, there's a burn center there.
Mm-hmm.
Mm-hmm.
Yeah. So why Utah? Why not do it somewhere else?
Well, we love the outdoors.
Oh,
and
all right.
It was kind of a nice distance between my family in Seattle and Tom's family here in Montana, so it was perfect for us. And also great training programs for both internal medicine and plastic surgery.
So you had enough time to do all of that while you were doing residency?
Oh yeah, we did actually.
Wow.
We had a lot of time to spend outdoors and explore all the national parks.
You're still doing that now?
Yeah, we love it here. There's just endless amounts of things to do outside, and it's been awesome for our family.
I have some yard work if you'd like. If you're looking.
Let me ask my kids.
Let's talk a bit about something that really hits a lot of people: seasonal affective disorder, or SAD. What actually is this?
Yeah, so seasonal affective disorder is a type of depression that occurs at specific times of year. It's thought to be related to reduced sunlight exposure, which can disrupt the body's just natural rhythm and chemical balance. Symptoms are most noticeable in the fall and winter, so the darker months, and they tend to significantly improve, if not resolve, by the spring or summer.
Is this something that would be a chemical imbalance in your system?
Right, yeah. They think that it's related to chemical imbalance in melatonin and serotonin and other neurotransmitters.
Well, there are a couple of things you can buy over the counter.
Yeah.
But does that help?
Well, it can help regulate. So melatonin, I think, is what you're referring to, and that can help with sleep. But that's not all seasonal affective disorder.
You know, when I lived in Southern California, I got up early in the morning, and the sun would rise early. And somebody said, well, if you go out on your deck and just have sunlight for 2 or 3 minutes, or daylight, it releases endorphins or something, and helps wake you up. So is that part of what's going on, is that suppressed response during the winter?
That is exactly it. You got it, Robin.
So how severe is this sort of thing? How bad can it get?
Yeah, so that is a great question. So sometimes we think of kind of these winter blues, and overall people feel this winter fatigue and feeling sluggish. This is a little bit more than that. So seasonal affective disorder is actually persistent symptoms that significantly affect your ability to function in your daily life. It's not just a day here or there. It's really throughout the whole season, nearly every day. And some of the symptoms, if I can talk about that. So trouble with sleep, in this case, sleeping too much, actually, overeating, particularly craving carbs, low energy, so much so that you can't even function and get through your day, difficulty paying attention or concentrating, feeling worthless or guilty, and losing interest in things you used to love, like your hobbies.
Wow, that doesn't sound like much fun.
No.
I like carbohydrates anyway, I'm wondering where one thing starts and the other ends, Well, I don't know if it's but we do talk about comfort food, in the wintertime. Could that be part of the response, I wonder?
Perhaps. Yeah, there's actually some interesting data to suggest that there actually is a strong craving for carbohydrates and certain foods that you're used to in this disorder.
Yeah.
So we don't have a lot of sunny days here during the wintertime. So do we have more people who are sad than in other places?
Yes. So about 3 to 5% of the general population will have seasonal affective disorder at some point in their lives, but there's a couple things that put you at more increased risk than others. So one of them, like you pointed out, are areas with longer, darker winters, like Montana, for example. There's also some interesting data to suggest it's more common in rural areas as opposed to urban or suburban areas. And then women are up to 4 times more likely to get it than men, typically starting in early adulthood, like age 18 to 30.
Well, now that we kind of understand what seasonal affective disorder is, SAD is what we kind of call it, and I guess that's really
Good name
what
for
it
it.
is. Yeah. What can we do to get rid of that?
Yeah, great question. So one of the first line treatments is actually light therapy, where you use a special light box that mimics natural sunlight. And these are commercially available. I don't think they're covered by your insurance necessarily. They're not FDA regulated, so there's lots of different types out there. But in general, we'd select one with 10,000 lux, no UV light, so no tanning beds.
Oh, okay. I wondered about that.
Yeah, it's in general, it's important to look at the manufacturer's directions, but in general, about 30 minutes in front of that light box can really help. I actually used one of those when I lived in Seattle during my college years, and that really was very helpful in resetting, kind of regulating the circadian rhythm. The other thing I like to recommend, which is similar, is just spending as much time outside as possible. So even limited amounts of natural light is really helpful. So I tell people even just 15 minutes, a brisk walk a day would be really helpful. And leads me to my other point, which is regular physical activity is actually a great treatment. Exercise time and time again has been shown to boost serotonin and endorphins, and we know that can naturally just lift your mood and energy levels.
Now, it's interesting. You had mentioned that rural, there seems to be more of a problem in rural areas than urban or city areas. I wonder if that could be the hubbub and the just natural activity that's going on, because I know, okay, we live in a rural setting,
Yeah.
and I get up at 3 a.m. and people say, how do you do that? And I said, well, the alarm goes up and I jump out of bed and I have a routine. I have to hose off, hygiene, feed the animals and all that stuff and get here. And so but when I have a day off, I just lay there, And I don't know if it's because I don't usually lay there or whatever, but I'm not very active, and I feel like I've wasted the day away.
Well, you love your work, Robin. That's one thing.
Mm-hmm.
And that is, if you're just going back to a job that you detest, I mean, that's enough of a downer.
Right.
So, but the city setting, do you think there's something, if you have activities, you get up, and I tell my wife, well, why don't you get up and do the dishes today? She's unamused.
Yeah, I was thinking about that when I read that statistic, and I think it's just really important to avoid social isolation, which can happen when you're very spread apart in rural areas. So I think one of the common pitfalls of winter is withdrawing from social activities, which are more common, of course, in the urban setting, and can worsen feelings of sadness and depression. And I'd make it a point personally to reach out and stay connected with friends or family, especially since they might be feeling the same way.
Yeah. It's interesting because we both worked in Seattle. You lived there, and I recall Seattle and Portland had high suicide rates, relatively high, and we do here in Montana also. And is that part of a component of this?
I actually don't know the statistics on if it's related to them having seasonal
I always
affective
just thought,
disorder,
well,
but-
it's gray. It's here, even in the wintertime, we have blue sky, and it's brighter. But Seattle and Portland, it's not so much.
Yeah, that's true.
Well, are there any medications that you can take to help you for this?
Yeah, so for those with more severe symptoms, antidepressant medications like SSRIs or Wellbutrin can help mood and improve the symptoms. Besides medications, there's also cognitive behavioral therapy, which is a type of talk therapy that can help people identify and challenge negative thought patterns and give them tools to cope with the symptoms.
Well, if you do medicate for something like this, what happens when everything's sunny and pretty?
So there are some people who are on seasonal antidepressants where they no longer need it in the spring and summer, and we can taper them off. It just
Okay.
depends on the person.
Yeah, those things always scare me.
Oh, why is that?
Well, I mean, just the whole notion of taking something to alter your way of thinking, the way you see things.
Sure, okay, I can see that.
Way of feeling more than
Yeah.
thinking, maybe. I don't know.
It can be a hugely beneficial tool for some people, absolutely. It has been life-changing for some of my patients, and I think has been around for a long time, and they're very safe medications.
So you mentioned tapering off, like for the summertime. Would you get too happy?
Oh, no, I wouldn't say that. It's just a lot of people probably don't want to be on a medication they don't
Okay.
need to be on.
Okay. Dr. Josephine Wright is our guest. We're talking about seasonal affective disorder, or SAD. Any concluding ideas about that?
Just the last thing, I always get questions about vitamin D deficiency. And so that is associated because people living in places with long winters, limited sunlight, they do have usually also a vitamin D deficiency and may benefit from supplementation. But just important to know that the research is mixed on whether it's effective as a standalone treatment for seasonal affective.
Now, my doctor primary has me taking D3.
Yeah.
Is that a component of that?
Yeah, that is vitamin D, and we usually suggest about 1,000 to 2,000 units a day for most people.
Okay, now, is it better to get it from fruits
I think
than...
a combination of both is
Okay.
great. And
Because
the sunlight.
sunshine fruits you think of.
Yeah.
Well, here I am again with primary care physician, and this is close to John's heart, Dr. Josephine Wright. Now, we used to call them something else before it was primary care, but it was like your family doctor or something, right? And what are the benefits? I know that you really kind of need a primary care to get a referral to a specialist, I believe.
No, that's true. That's one of the benefits, of course. In terms of our topic, your primary care doctor plays a big role in helping you diagnose things like this. They are often the first point of contact when you start experiencing symptoms. And they can help you evaluate your symptoms and rule out other conditions that might mimic what you think you have. Like, for example, for seasonal affective disorder, you have severe fatigue. Well, your primary care can evaluate you for other causes to just make sure we're not missing anything, like thyroid disorders or anemia. But having an established relationship and a good relationship with your primary care provider is especially helpful because they know your medical history. They can tailor your plan to your needs. They can monitor your progress, keep checking in with you. And then, as you mentioned, Robin, they can refer you to specialists if needed.
Yeah, I went to ear, nose, and throat because I go through this spring and fall, and I'm tired of it, And I actually got a nasal spray that seems to be working
Oh,
a
good.
little bit. So that was a referral.
One of the things I think that I'm listening to my voice here. I'm going through puberty again, folks. One of the things I think that's really important is regular checkups. You do this with your car, for crying out loud. Every few thousand miles you change the oil. You have somebody look at it, and you monitor all the signs. The same thing with lab tests, things that you do.
Absolutely.
And over a period of time, you've got a pretty good idea of where your patient stands.
Right. Totally agree.
Yeah, my primary care, I had a couple of blood panels done, and he's watching that with the supplementation that I'm taking.
Yep. Great idea.
Likes what he's seeing, so I guess I'm happy about it too.
Well, in establishing this relationship, oftentimes you can spot things that the patient isn't even aware of.
Yeah.
Things that could develop into something really bad.
Right.
Okay.
So as far as
I guess the next question is, how do you get a primary care physician?
Oh, good question. So if you don't already have a primary care physician or primary care provider, it could be a huge difference to have one, and especially in the terms of the seasonal affective disorder when you have early intervention, it can be key. And if left untreated, this condition can get a lot worse. So for those looking for a primary care provider here within Logan Health, we do have a list of all our primary care providers on the Logan Health website. I believe it's logan.org/primary care. And there's a filter you can select to show you who's accepting new patients, which makes it really easy for you to see who to
Yeah,
call.
you're seeing a lot of patients.
That's right.
No, you aren't. I mean, it's busy.
Mm-hmm.
You know, so you really have to be careful, you know, to make sure that you don't spend all your time looking for somebody.
That's right.
Yeah. All right. Well, this has been a great conversation, and I'm sorry my voice hasn't been better. I haven't been keeping up this like I usually do. But Dr. Josephine Wright, thanks for all you're doing. We appreciate it.
Oh, thanks for having me.